Hi, my name is Stephanie Cox, and I am doing my presentation on exercise and arthritis. So what is arthritis? Arthritis can have many different causes. It can be from breakdown of cartilage, which would be osteoarthritis. It could be from an autoimmune disease, so basically your body would attack your healthy cells in your synovial membrane and cause inflammation, and that would be rheumatoid arthritis. I'll talk a little bit more about those on the next slide. Arthritis targets your joints, so this can be like your fingers, your wrists, your shoulders, your hips, your knees, your ankles. Some of these are pointed out right here on the picture on the slide. So this can cause the most common symptoms are inflammation, pain, stiffness, or decreased range of motion. It can also cause things like deformities of the bone in more severe cases. There are many different types of arthritis. Like I said before, I will be focusing on osteoarthritis and rheumatoid arthritis in this presentation because they are the two most common, but there's also things like juvenile idiopathic arthritis, which is in childhood. There's also gout, and there's so many more. So osteoarthritis is the most common form of arthritis. So that is a degenerative joint disease. It's caused by mechanical wear and tear. It's kind of when the cartilage within a joint begins to break down, and it affects over 32.5 million US adults. If you look at the picture, the first picture is a healthy joint. The second one is osteoarthritis, and you can see the light blue cartilage has worn down and the bones are starting to rub on each other. So this can develop very slowly, but it can get worse over time. This can be pain or aching, stiffness, decreased range of motion, or swelling, and it's often diagnosed through a review of symptoms, a physical exam, x-rays, or lab tests by a doctor. So rheumatoid arthritis is an autoimmune and inflammatory disease. So it means that your immune system attacks healthy cells in your body by mistake. So basically your body would attack the synovial membrane that protects the joints. So you can see, if you compare the picture all the way on the right is the rheumatoid arthritis, you can see all the swelling on the side and how there's nothing left in between the bones. And compare that to the healthy joint. This can cause very similar symptoms to osteoarthritis, like the pain or the aching in the joint, stiffness, or swelling, but it can also have a little bit of different symptoms like fever, weight loss, fatigue or tiredness, or weakness. It's also more common to have the symptoms on both sides of the body, like both hands or both knees or both hips, instead of just one or the other. So what's important to remember with risk factors is that some you can change and some you can't. So for the non-modifiable risk factors, it's just important to be aware of them. So for age, as you get older, you have an increased risk of developing arthritis. Gender, women are more likely to get the more common types of arthritis like osteoarthritis and rheumatoid arthritis, but they may get it later in life than men. It'll just come on faster and probably hurt more. Genetics, you have a higher risk of developing arthritis if a close family member or relative has had arthritis as well. For the modifiable risk factors, there's overweight and obesity. This can just cause extra strain and pressure on your joints. Joint injuries, you just want to be able to do your best to avoid them. So you can do this by making sure that your exercise techniques are correct so that you avoid any extra strain being put on your joints. Smoking is also a risk factor. Your occupation can be a risk factor, and while I wouldn't say you can always just change your occupation, but you can look into ergonomics. So this could range anywhere from making sure that your desk chair is at a good height to help your posture, or making sure that you're lifting objects with correct form, if you're depending on what your occupation actually is. Infection, well, you may not be able to control whether or not you get an infection. You can make sure that you seek help as soon as possible once you notice symptoms that can be like redness or swelling or warmth. So there's no cure to arthritis, so the treatments for it mostly focus on managing symptoms. So the first one is exercise, and that's what this presentation is mostly focusing on, and I will get into more about that next. Physical therapy can help a lot with range of motion and flexibility and strength. And strength will help a lot if your muscles are stronger around the joint. It'll help take the pressure off the joint. Weight loss, same thing, it'll help take the pressure off the joint. There are medications, there are devices like crutches, canes, and walkers that will help you kind of displace some of that weight off of those joints. And then in severe cases is surgery. So for the first research study here, it was a review of multiple studies that looked at randomized controlled trials, and it looked at the effects of exercise to improve aerobic capacity and muscle strength in people with rheumatoid arthritis. So the results showed that there is more and more research coming out that shows support of the benefits of aerobic and strengthening activity in patients with rheumatoid arthritis. So 7 of the studies they looked at indicated reduced disease activity, and 9 showed that they were unchanged. So that doesn't mean it was worse, so it sounds like it may be worth the time if it's even possible to reduce any disease activity. 8 studies saw increased muscle function after strengthening exercises and 6 did not. So the stronger you are, the less stress that you can put on your joints. They ended up recommending that you do a mixture of aerobic and strengthening exercises. So aerobic, you would do about 60 to 85% of your maximal heart rate about 3 times a week for 30 to 60 minutes. And strengthening exercises, you would do about 50 to 80% of your maximum voluntary contraction about 2 to 3 times per week. For the next study, this is looking at rheumatoid arthritis or osteoarthritis patients that were hospitalized because of symptoms due to their arthritis. So they ended up receiving very intensive exercise training 3 weeks after discharge, and then they compared it to a control group. So their intense training basically was about 2 to 4 times a day for about 30 minutes. They did individual and group sessions. They did aerobic training daily at about 60% of their age predicted heart rate max. They did at least 3 hydrotherapy sessions a week. And they worked on daily activities like walking up the stairs, carrying groceries, anything in their daily normal life that they wanted to work on. The intervention group showed improvements up to 12 months, even just after 3 weeks. So the results, they showed that there was improved range of motion at 3, 13, and 26 weeks, and improved functional ability at 3, 13, and 26 weeks just from these 3 weeks of intensive training after their discharge. They did not show any difference in health-related quality of life assessment, but I would be curious to see what that would show if the intervention was a little bit longer. It's also important to note with this study is that it was very individualized, so it was based on their heart rate, their intensity of their exercise was based on their heart rate, what daily activities that they wanted to work on. They did more or less hydrotherapy sessions depending on their individual goals and what they could handle individually. For this third study, this was mostly for patients with knee osteoarthritis. They did an intervention. It was 4 weeks long, and then they were instructed to continue this at home afterwards. And they again compared this to a control group. So they did manual therapy to their knees as well as their spine, hip, and ankles. They did muscle strengthening exercises and aerobic exercises like stationary bike riding, which is good because stationary bike riding seems to be very favored among arthritis patients because it doesn't put a lot of stress on the joints. They also noted that they had to make sure that their signs and symptoms were either stable or decreasing before they decided to do any further progression. So the results showed that the intervention group showed significant improvements in their 6-minute walk distance and their WOMAC scale. The WOMAC scale is basically a sum of their pain, stiffness, and function scales. And it showed improvement at 8 weeks and at 1 year. And they also reported that they reported down what they exercised even after they continued at home, and they adhered to the exercises pretty well. The participants also reported 20 to 40% symptom relief just after 2 to 3 therapy and exercise sessions. So that's great that even just 2 to 3 30-minute sessions showed effects. It also stated that it may delay the need for surgical intervention. So in conclusion, aerobic and muscle strengthening exercise could be beneficial for people with osteoarthritis or rheumatoid arthritis based off of those research studies. It's important that it is tailored to the individual. There's not one set plan that is good for every person with arthritis. It's also important to monitor the pain. You don't want to push past the point of too much pain. And there's no cure. Exercise is just a way to manage symptoms and possibly slow the progression of the arthritis. So for the test question, which of the following is true regarding osteoarthritis and rheumatoid arthritis? So A, being overweight is only a risk factor for osteoarthritis. B, they are both autoimmune diseases attacking the synovial membrane that protect the joints. C, only osteoarthritis causes stiffness, while only rheumatoid arthritis causes pain and inflammation. Or D, aerobic and strengthening exercises is recommended for both. So the correct answer is D, aerobic and strengthening exercises is recommended for both osteoarthritis and rheumatoid arthritis. So A is incorrect because being overweight is a risk factor for both osteoarthritis and rheumatoid arthritis. Sometimes people might get that confused just because rheumatoid arthritis is an autoimmune disease, but the obesity can definitely make it worse and is still a risk factor for it. Second one, B is incorrect because only rheumatoid arthritis is an autoimmune disease. Osteoarthritis is from the mechanical wear and tear, breaking down the cartilage. C is incorrect because osteoarthritis and rheumatoid arthritis both cause stiffness, pain, and inflammation. And this is my references, so thank you for listening to my presentation.